My name is Stephanie Frid and I'm a strategic designer at Experience Design and I work in the innovation program. So being a strategy designer at Philips is quite an exciting role. You really get to work with some amazing people across the organisation, and your role is really there to problem solve and understand what the key challenges are within the health system, what drives those challenges, and how we design solutions to overcome them. Kind of the main challenge and goal of a COVID-19 care pathway was having a better understanding of how people with the COVID-19 disease flow through the healthcare system. And it was really kind of acknowledging that health systems were at breaking point and we needed to respond really quickly as a health technology company, so then we can understand where the needs and pressure points are across that pathway. And then we can start to actually deploy our health technology solutions in a way that helps health systems overcome those challenges. So a care pathway is a design tool, really, that's used very widely in the health sector, that kind of paints the picture from the patient's perspective and then the key healthcare interventions that need to take place across that care pathway. That's really core for us as a health technology company. We need to have a really good understanding of that pathway in order to kind of utilise the existing solutions we have and adapt that to the COVID-19 response, or potentially identify kind of new areas where health technology could really add value to COVID-19. So it was really important for the understanding piece, but also really thinking through how we could connect our products, services and solutions across that care pathway to help support health providers. And in some cases, care pathways are also used to actually help redesign that model of care as well. So you may look across the care pathway and understand where the key pressure points and challenges are and actually redesign that model of care to better improve outcomes. Care pathways would have been evolving and developing day by day as new evidence was evolving. And so that allows them to understand, what is the best practice that people should follow in a health system to support people to get the best outcomes with COVID-19. Really exciting to be part of the Philips organisation because of the amazing things we were able to advance in such a short space of time. And there are kind of three key examples that spring to mind. And the first one looks at the start of the care pathway. So when people become unwell in the community, how do they self-manage? So we had a project looking at Philips screening and follow-up, which looks at kind of a mobile digital tool that would enable you or I to track our symptoms and also get follow-up if we look like we are deteriorating or at risk of COVID-19. So the second really exciting project was an incredible concept that looks at really responding to the rapid surge in demand for hospital services that were needed during COVID-19. And it was the medical ICU project. And that was a really cool concept, looking at how we could create kind of isolation mobile units, but they could provide medical care in them, but also integrate the technology and the digital infrastructure in them as well. So that would obviously really support kind of the hospital phase of our COVID-19 care pathway. And then the third key project is around how we support people to get monitored in hospital, but at a distance, so we keep our staff protected and not at risk of COVID-19. And that's a project called the Health Dot. So it's a wearable device and it looks at either monitoring in hospitals, so the staff don't have to go in and keep getting the vitals of patients every kind of 10 minutes. And it also looks at getting people to home faster as well. So it means you potentially could be discharged out of hospital and that remote monitoring can still take place from the clinical team. The biggest learning for me was around the importance of collaboration. Collaboration. We had to work across, so many people internally in the organisation and across our global sites in order to get the right expertise together to create the care pathway. And for me, that's so important, more so because of how we should design in the future.